And I am so glad to be here with all of you. I am from Crushing Colonialism. We are an Indigenous-led 501c3 nonprofit in the so-called United States that uplifts Indigenous people through arts, media, traditional storytelling, while supporting those doing the work. We were founded in 2016 and operated by Indigenous people working in a variety of storytelling fields across the world. We work to increase the pay and employment of Indigenous storytellers while also promoting their work, providing funding for media and arts projects, and increasing access to professional representation. We operate in a decolonial disability justice framework, which is the impetus for our participation in the 60-hour Medicaid Vigil. Who better to share the healthcare experiences and needs of American Indian and Alaskan Native people than a storytelling organization run by a team of several chronically ill and disabled people. We use the term American Indian and Alaskan Native as this is how data is collected, and we are a specific legal class of people. However, these are not our terms for ourselves. AIAN people have the highest rates per capita of disability in the so-called United States. 38.7% of AIAN people are disabled. That is 2 in 5 American Indian and Alaskan Native people. In 2022, the AIAN life expectancy was lower than the life expectancy for the general population in 1950. These figures are due to social determinants of health that are the result of over 500 years of genocide that never ended. In 2025, the poverty rates for AIAN people are estimated between 22 to 24%, according to the International Work Group for Indigenous Affairs. We are impoverished at a rate more than double that of non-Hispanic white people. However, AIAN people and tribes are not a monolith, and some tribal nations have significantly higher rates of poverty than others, leading to even more desperate situations for some of our community. Approximately 2.7 million AIAN people are enrolled in Medicaid, with 24% of adults aged 18 to 64, as well as 23 of those over 64 enrolled. Almost 49% of AIAN children are enrolled in Medicaid. These stark cuts to Medicaid are compounded for the Indigenous people and tribal nations of the so-called United States due to the already existing lack of resources and generations of underfunding. I'm going to go into a little bit about our health programs so you have a context before I share the various testimonies that we've accumulated. The federal government has a trust and treaty obligation to provide health care to the enrolled citizens of federally recognized tribal nations. The Indian Health Service is a federal agency tasked with this obligation. Tribal leaders estimate that significantly more funding is needed for IHS to operate properly and meet the healthcare needs of citizens. IHS currently operates with a budget that addresses only an estimated 48.6% of healthcare needs for AIAN people. The chronic underfunding has led to high staff vacancy rates, rationing of healthcare services, and outdated facilities and equipment. Many of the IHS facilities are old and in poor condition. The state of medical equipment is unknown because IHS does not have complete or reliable data. The National Tribal Budget Formulation Work Group, who represents the 574 recognized tribes, recommends $73 billion for IHS for the fiscal year 2027 tribal budget recommendations. For comparison and understanding of horrific chronic underfunding of IHS, the current administration budget proposed budget for fiscal year 2026 is only $8.1 billion. This has been an issue across administrations, but recent service cuts to Medicaid only worsen the already dire situation. Much of the health care paid for by IHS includes the Purchase Deferred Care Program, PRC. PRC covers essential health services from non-IHS providers when said services aren't available within IHS. According to the work group, much of the secondary care and nearly all the tertiary care in Indian country is purchased from non-IHS facilities. The severed lifeline that is Medicaid will only exacerbate the lack of overall healthcare facilities as well, especially in more rural areas. Clinics and hospitals that depend on Medicaid dollars will close, making the opportunity for PRC and Medicaid-covered care impossible for AIAN people, leaving our most vulnerable without any care. The work group recommended $12.6 billion for PRC's fiscal year 2027 IHS line item versus the little more than $1 billion appropriated in the 2025 budget. Onto our urban and Indian organization healthcare, our tribes have citizens that are across the so-called U.S. in rural and highly remote places, as well as those in densely populated areas. In 1940, only 8% of AIAN people lived in urban areas. Today, 71% of AIAN people live in urban areas. The U.S. termination and relocation program of the 1950s and the 1960s was a continuation of the theft of tribal lands and attempt to destroy tribes entirely. Further, by removing Native people from our land, the urban areas we were cut off, we were cut off from access to many IHS and tribal health facilities, making Medicaid crucial to our survival. Native people were promised jobs, education, housing, and healthcare if we left our tribal lands for the cities. As the colonizers have always done, they broke their promises. Currently, the federal government contracts with 41 urban Indian organizations, which operate over 80 facilities in 38 urban areas nationwide. UIOs were created in the 1950s by urban AIAN people and tribal leaders to address the many dire consequences of federal government's termination and relocation policies, including health, education, and housing. UIOs are fundamental for the well-being of Native people and tribes. They provide a wide range of health care and social services, including primary care, oral care, HIV treatment, substance abuse treatment, behavioral health, diet and nutrition classes, cultural and educational programs, and traditional medicine. Patients from over 500 federally recognized tribes are served by the 41 UIOs. Tribal leaders recommend $1.9 billion to fund the IHS Urban Indian Health line item for fiscal year 2027 tribal budget recommendations. UILs only receive direct funding through a single line item. Urban budget line items, further limiting the services provided. In the past, Urban Indian Health line item has received only 1% of IHS's budget. In the 2025 AHS budget, only a little more than $219 million was given to UIOs. Now, I want to speak a little bit for what our executive director created to explain the importance of Medicaid for a small organization like ours. There's a special work-related circumstances that necessitate a higher need for Medicaid. Exorbitantly high prices for private insurance to both employers and employees means that many people working for smaller organizations and businesses or who are self-employed rely on Medicaid for health insurance. 1/3 of Medicaid enrollees work for small businesses or family members of small business employees. Even 20% of small business owners are enrolled in Medicaid. Per capita, AIAN people face the highest unemployment rates and are the least likely to hold managerial positions in the so-called US, meaning access to employer-sponsored health insurance is considerably lower for AIAN people. However, we have higher rates of self-employment at 10%. These realities make Medicaid even more crucial to AIAN people and tribal nations. We at Crushing Colonialism are worried about our own ability to recruit and retain teammates that we can support in ways needed to live a joyful and healthy life while also contributing to the collective work and community that we strive to achieve. As a very small nonprofit with an annual budget of less than 0.5 million, we aren't in the financial position to offer our team health insurance or other benefits. We already struggle to find and retain team members due to the absurdly tight income restrictions for adult Medicaid enrollees. So-called U.S. Needs a fully funded, upgraded, and free healthcare system for all. Instead of the opposite is occurring. There are countless factors that impact AIAN access to healthcare, including safety and medical facilities. We have a long history of being forced and coerced into medical experimentation, sterilization, and a host of other racist and violent actions by those in the medical field. This administration has added another fear to the list. A recent policy has given immigration and ICE enforcement, or customs enforcement, ICE, access to every Medicaid recipient's personal information, including date of birth, social security number, ethnicity, and race. The government claims this is to find illegal immigrants, but they're not eligible for Medicaid benefits. This is particularly alarming for oppressed peoples. ICE has arrested tribal citizens, and the government has even claimed that AIAN people aren't American citizens. Not only is this patently untrue and racist beyond measure, ICE could use Medicaid data to target, hunt, kidnap, deport, and even kill AIAN people, as well as others in the government wants gone. ICE and government actors have repeatedly demonstrated they won't abide by their own laws, nor do they have any sense of humanity. People even being kidnapped during medical appointments and procedures. The One Big Beautiful Bill has impacted healthcare for generations in numerous ways. Of the all of the 73 tribal colleges and universities are at risk of closing or making very severe cuts to staff and programming due to potential budget cuts of 90% by the Trump administration. 75% of the TCU's funding come from the federal government. This impacts our tribal nations in a number of ways, including the education and professional support of future health care workers. How does a 19-year-old with no car or money but a dream of becoming a doctor start their education if the tribal college on their reservation has closed? How does a single working parent further their education and become a mental health therapist to treat Native people for the centuries of trauma of their local tribal colleges are closed? What happens to the Native people who want to work directly with patients as social workers or health aides? The answer is that they don't receive an education, and our nations suffer further genocide. The so-called U.S. and IHS are always facing a massive shortage of healthcare workers across all sectors and specialties that will only worsen as the U.S. destroys the educational system for all, but the wealthiest of people. We are indeed in dark times in the so-called U.S. and globally, but where we are now is rooted in our past. Until we confront the legacy of white supremacy, racism, sexism, ableism, xenophobia, classism, anti-queer discrimination, and institutional oppression, we cannot solve the healthcare crisis. It is not a crisis by accident, but rather by nefarious design. Despite the conditions we're under, we must dream of and strategize and fight for a world we deserve that is rooted in justice, decolonization, liberation, and love. This vigil is one piece of the puzzle. There is power in our collective organizing and ways of being. We can learn, unlearn, grow, and heal together as communities, tribal nations, and beyond. We must immediately take space for our most attacked community members to lead the way they see appropriate and affirming. As pieces of this work, we offer personal testimony on the importance of Medicaid directly from our AIAN people and organizations. sorry, this is testimony number 1. Medicaid has been and still is keeping my family alive. As a disabled, autistic, homeless community organizer, I am traveling the country helping orgs and groups produce COVID-safer events. With the few spoons I have left, I am focusing on surviving, so I am overwhelmed by the process. I can't currently access Medicaid or any health care. Even as I am trying to get help, it is hard to find. But with the funding cuts and attacks on autistic, disabled, queer, homeless, and Native Indigenous people, all of which I am a part of, I am not sure that there will be a system or funding by the time I apply. Medicaid helped my mom avoid metastasizing thyroid cancer. It helped save my brother from losing their foot, from living in an area of food apartheid and no public transportation, and helped my sister survive both her pregnancies with the complications of Ehlers-Danlos syndrome that we all have. We are natural-born citizens to the United States, but because we are brown, we are in danger. Danger of our own government and the people who keep just following orders, to ignore and dismantle public health systems. In the U.S., one COVID infection can disable you, kill you, or have you drowning in medical debt. Although we are citizens, we can't at any moment be kidnapped by this government with no due process and sent to concentration camps, profiting from the modern-day slavery system of private prisons, just for being Native. Defunding Medicaid is one domino in the many being knocked down right now in order to stabilize our social care network and make it harder for for us to live. That is their goal. We reject the notion that anyone has to be productive to have value. That is the colonizer's mindset, and we will not stand for it. We have value by existing, and we all share in the community care needed to keep society functional for us all. Any act to support your community is one more drop that powers the strength of the ocean. From wearing a mask to feeding your neighbors, it all counts. For us all to have access to health care, it is vital for everyone to act. This is Jacina from One Free Community. Second testimony. Medicaid is how so many of us survive. From disabled, Native people, it is often the only way we can access care, equipment, support, and the need to live, and support we need to live. Since more than 80% of all Native people don't live on reservation and do not always have access to or Indian health services. Native communities already face some of the highest rates of disability, chronic illness, poverty in the United States as a result of centuries of broken treaties, stolen land, and underfunded healthcare systems. And yet, every time the budget is discussed, Medicaid and Indian health services are on the chopping block. It makes the statement that disabled and Native lives are expendable and unworthy of unalienable and constitutional rights to life, liberty, and the pursuit of happiness. Protecting and expanding Medicaid is fulfilling the promise of those rights by keeping our relatives out of institutions, keeping families intact, preserving our communities. It is about ensuring that disabled Natives can live with dignity, autonomy, connection, but make no mistake in believing it is the solution. Protecting Medicaid is the bare minimum. Expanding Medicaid is the bare minimum. But it is a step forward to a future where healthcare is accessible for all. This is Johnny J. from the Otay, Missouri, and Choctaw Nations, and is the webmaster and board member of Crushing Colonialism. And testimonial 3. To say that the very real threat to our community with the loss of Medicaid is terrifying to an understatement. I recall the days before the passage of the Affordable Care Act, when relatives in Baltimore American Indian community had to make the difficult choice to neglect their health, often very real disabling conditions, and keep a roof over their head, or leave the employment that paid their rent so they could pursue disability. You see, in Maryland, prior to the ACA, you needed to prove that you had a physical or mental health disability in order to access Medicaid. But to be disabled meant you could not work. We were gratified that Maryland decided to expand Medicaid under ACA, meaning that people could do work that was meaningful and still treat their chronic and disabling conditions so that they could enjoy a better and more dignified quality of life. Medicaid expansion was especially important for our tribal citizens because there are no full ambulatory Indian Health Service clinics in the DMV. Services provided by our outreach and referral were often suboptimal. While we are fortunate to receive funding to pay for medical, behavioral, and dental services prior to the ACA and the medical expansion, these funds were never enough for the real needs of the uninsured and the complex those with complex medical needs. But with Medicaid expansion, the Indian Health Service encouraged all tribal citizens and urban Indian beneficiaries to apply for coverage. Doing so allowed relatives to receive comprehensive services they needed and allowed our organization to do more with our limited funding, including pay for prescriptions, eye exams, and glasses, durable medical equipment like wheelchair and scooters, and much needed preventative and restorative dental care. Loss of Medicaid will truly imperil the lives of our relatives, especially those with disabilities. It will mean that urban Indian health programs will need to limit care at a time when demand for care increases. It means watching the quality of life of our relatives decline, watching the house of cards that are social determinants of health collapse among themselves. It means that those who may not be fluent or proficient indigenous language speakers or our cultural bearers and medicine keepers become too ill to share their knowledge. The outcomes are truly too dire to overstate. During the height of the COVID pandemic, our community spoke of being a good relative by taking care of ourselves and of each other. The prospect of scores of relatives losing coverage and suffering declines in wellness and social stability will greatly hamper our ability to be the relatives we want to be and know we can be. The loss of Medicaid is yet another blow we cannot afford. This is Carrie Hawk Lizard from the Native American Lifelines. Osio, greetings. My name is Tony Enos. I am a Two-Spirit Cherokee artist and musician, and HIV has been living with me. For the past 19 years, I am the boss. I always be the boss. Sounds like the word of an empowered person, right? But that person wouldn't be alive today without the city of Philadelphia and the Medicaid program that sustain and treat so many people like myself living with HIV today in the so-called United States of America. Some genocides are more blatant, like those happening in Palestine, and some are more subtle and insidious, like the alleged leaders who enact them. Make no mistake, the attack on Medicaid is an enactment of genocide. When Donald Trump told Dr. Fauci to just let COVID-19 wash over the country, his allegiance to the blessed dollar and not the citizens who he serves became evidently clear. On all U.S. currency is printed the words, "In God we trust." They're talking about money. That's their God. That's what they worship. But the opportunity has come for us to prove that the value of human life and sustainable holistic health cannot be measured in goddamn dollars. Universal health care is a basic right. The right to health and a thriving quality of life is universally inherent, and we will not stop fighting until the so-called United States makes good on an ideology that has never come to fruition in almost 300 years. Liberty, justice, and justice for all. That includes health. Testimony 5. Dear relatives, On behalf of the Two-Spirit and Native LGBTQ Center for Equity, I write to express our deepest support for the preservation and expansion of Medicaid services. Medicaid is not just a public health program. It is a lifeline for many in our community. For Native people, particularly Two-Spirit and LGBTQ plus relatives, elders, and those living with HIV, Medicaid is essential to accessing equitable, culturally affirming, and life-saving care. Two-Spirit people have always held sacred and vital roles in our tribal nations, but today we face disproportionate health disparities rooted in colonization, discrimination, and underfunded health systems. Medicaid helps bridge the gap by providing access to mental health care, gender-affirming treatment, substance use services, HIV medication and treatment, and care for chronic conditions that affect our community at higher rates. Our Native elders and HIV-positive community members rely on Medicaid for continuity of care, medication, home-based services, and dignity in aging. LGBTQ plus Native people, especially in rural and tribal areas, are often lack alternative options for health coverage, and face unique barriers due to stigma and systematic neglect. Without Medicaid, many of our relatives will go without basic health care. This is not acceptable. For our organization, which exists to uplift and serve Two-Spirit and Native LGBTQ plus people, Medicaid is not just a policy issue. It is personal. It affects our families, our future, and our tribal sovereignty to care for our people in ways aligned to our cultural values and teachings. We urge you to protect Medicaid and to assure that its program continues to be inclusive, accessible, and adequately funded for Native communities. This includes honoring the government-to-government relationship between tribes and the federal government, and recognizing that health equity cannot be achieved without justice for our Two-Spirit and LGBTQ relatives. In strength and solidarity, Elton Naswat, from the Executive Director of Two-Spirit and Native LGBTQ Center for Equity. Testimony 6. I'm multiply disabled, chronically ill, bisexual, Two-Spirit woman, and citizen of the Cherokee Nation of Oklahoma. I'm also a Medicare and Medicaid enrollee, and I receive IHS and Urban Indian health care benefits. My life is literally in the hands of the federal government. And given who I am, that is truly terrifying. Losing my health care would be a death sentence. I'm already struggling without necessary care, as too few doctors have the level of expertise and facilities I require, except Medicaid where I live. I don't have the home health and personal care attendant services that I need either. My survival is in the death cult that is the so-called United States, and is a weight too heavy to bear, and it's killing me. I did everything I was supposed to do. I left my rural community on my nation's reservation for urban life. I worked and fought my way through fancy private universities, obtained degrees, and built an extensive resume. It wasn't enough. In order to maintain some of the health services I need as a severely disabled person, I must remain impoverished and dependent on the government for my survival. The government and everyday ableists claim I am a burden, while they literally left me the choices of working to the best of my current abilities. And pursuing my passions. But having zero healthcare leaving me unable to live the life of my choosing, or I can have subpar and often dangerous healthcare, but have to settle for an ambitionless and poverty-stricken life. Currently, Medicaid pays for my monthly Medicare and prescription plan premiums and covers 20% of my medical bills that Medicare does not. Covers the copays for all doctors and health visits, and as a federally enrolled tribal citizen, it also covers all of my prescription copays. If I lost Medicaid, It would cost me thousands of dollars annually and would cause me to further ration the care I need. I live in fear of further cuts to IHS, as some of my medical expenses that aren't covered by Medicare and Medicaid have been paid for through the Urban Indian Health Purchase and Referral Care System. I see our Native healthcare professionals scrambling every day to care for our people, but the government refuses to honor its own treaties, which are the supreme law of the land. But we also can't expect a government that wants much of its populace enslaved through the prisons, industrial complex, or dead to provide basic human needs, such as healthcare. I exist every day knowing that someone wants me dead. In a country where the president demands traumatic racial slurs and Native people demeaned as mascots for commerce, political pundits claim we should have killed more Indians, and the foundational document for the creation of the so-called U.S., the Declaration of Independence, refers to Native people as merciless Indian savages. I've never had the luxury of good health, liberty, or the pursuit of happiness. I'm not with you today as I'm having yet another medical procedure. I'm able to have this procedure because I have Medicare and Medicaid. To say Medicaid is a lifeline for myself and others is an understatement. It's no surprise that our government hasn't properly funded Medicaid and is now hell-bent on destroying it. Controlling a populace is much easier when they're destitute, in horrible health, without education, housing, parks, arts, and a clean, natural environment. The intersecting forms of oppression that communities will suffer as a result of this administration's eugenicist actions are too many to name in the time I have. Hope is in limited supply these days. My health is worsening with little hope of it slowing down. My quality of life continues to decline. The options available to me are few and far between. Health and medical research for my lifetime and generations to come have been demonstrably impacted due to the fascist government. The racist, sexist, anti-queer, and ableist restriction on federal funding, as well as the attacks on scientists and physicians, have ensured that I don't stand a chance at better care in the future due to advanced research. This builds upon the already existing lack of vital medical research due to the government's restrictions, such as those on stem cell research. Each cup runs deep, and I'm tired of bleeding out because our fascist colonial government privileges a few and wants to create the world's first trillionaires off the backs of the populace who they aim to control. It's catastrophic to individuals, families, communities, and the country, for millions of people losing the only healthcare coverage they have, so that the president can return a profit off of his Secret Service coverage by renting his property back to the federal government. I am enraged. Super yachts, multiple mansions, and private jets don't deserve precedence over my life or yours. Healthcare is a human right. It shouldn't be a for-profit venture, nor should our government limit access. There is no reason for anyone in the so-called U.S. to go without high-quality, culturally relevant, integrated healthcare, home care, and holistic care. I try and think and organize for the future we could have and deserve. I'm tired of fighting for the bare minimum. I'm tired of the few crumbs that the colonizers deign to throw my way. I am a survival of generations of genocide. My ancestors suffered the horrors of multiple colonial wars. We were tossed around among European nations until the U.S. became our overlord. We fought and lost many. My ancestors survived so that I may be here today. I too will fight for my people, for my tribal nation, for myself. My testimony today is but one action of this warfare. Even if I lose Medicaid, even if they kill me, my words will live on in solidarity. Now I'm going to give my own personal testimony, and it's not scripted because I wanted to make sure that it comes from inside me instead of on a paper. I am an autistic adult. I am the parent of 3 neurodivergent kids. My oldest is 21, and he is autistic. My middle is also is multiply neurodivergent and 20, and my youngest is 11. And we live in Texas. So we have been where y'all are going already. We haven't had Medicaid expansion. I have not qualified for Medicaid except during pregnancies in my adult life because I live in Texas. My kids, however, do. They have qualified for Medicaid their entire lives, except the brief time I worked here in DC. And the reality is that I am not going to get on the stage and have the same sob story that you've heard all day of parents that are hoping that Medicaid will continue to cover their kids' sheltered workshops and day hab facilities and the things that keep us segregated from our communities. I'm not going to tell you that because that's not what I've done with my kids. I am trying to give them a life that they can have autonomy. And now that is threatened by all this because they will not lose Medicaid. I'm not worried about them losing Medicaid. What I'm worried about is that they will continue getting the subpar services that we see throughout all of these testimonies. Because as the budget declines, their MCOs are not going to be able to provide the intensive case management services that they have now that allow them to learn how to navigate all the social safety nets that they need to do to survive when I'm not here. And that is essential for them to live after I'm gone. Not only that, and the problem is that they are just now qualifying for these services, right? They are just now entering these transitions. And we don't know where it's going to go. We have no idea how much is going to be stripped away. We do know that for years and years in this Texas legislature, we fought to get an increase in pay for personal care attendants. And 2 years ago, we were able to make that happen. It raised $2 a year, or an hour, 2 years ago. And now with these cuts, we know it's going to be rolled back. There is no reason to believe in Texas it's not going to roll back. And it is a reality we have to live with. Many states, many progressive states will go on to find ways to support their Medicaid recipients. But that is not who we're worried about here. We're worried about the millions who will be kicked off in red states that did take the Medicaid expansion, that the Medicaid expansion automatically gets rescinded when the federal government isn't putting in the dollars. We're not worried about the states who can fill in the gaps because they believe in caring for their people. We are worried about the people that are in Oklahoma, the tribal nations in Oklahoma that will not be able to get these healthcare services filled, that will have every single level of healthcare services shattered. And not only that, I want to speak about my daughter. She's 11 years old and she is entering middle school. She's not autistic, she has a different developmental disability. It impacts her speech. And for a year now, we've been trying to get her speech services through school because services in schools have diminished so much in Texas. And now we're going to watch them diminish more in Texas because do you know how much Medicaid dollars go to provide special education services in schools? They are a large part of the budget to provide nursing care in schools. They provide speech services. They provide behavioral services. They provide so many things, and that budget is being decimated by these changes because there is no way that cost sharing is going to go back to the schools, which is really, really upsetting. Do you want to know how upsetting it is? We actually got a bill through this legislative session to increase the budget of special education services in Texas. And in 2 years, with these Medicaid cuts, we're just going to see that pulled back. Those monies that we just got to our very, very destabilized education system will be for naught because the federal government took our funds. And the reality is that this is not new. This is not different. I have been disabled my entire adult life. When I was 19 years old, I started receiving mental health services. I nearly was put into mental health housing in my early 20s. And I'm very lucky that my family was able to take me back in so that I wouldn't be home, because I was facing homelessness. And the reality is that at the time, this was the only way I could get care, was to live with my parents, which wasn't great because they were abusive. But it was better than being segregated into mental health facilities. Even when I got pregnant with my oldest child, I had to live with my sister in order to get basic prenatal services. And those are realities that many people face, because at the time I was living with my parents, and I wasn't allowed to have Medicaid if I was living with my parents. You still can't do that if you live with your parents. If they are providing for your care and support, you cannot get that without completely restructuring how your life is set up, which my parents did not know how to do at the time. My kids are lucky because they have me as an advocate. And they tell me that all the time, which is really upsetting that my kids are aware enough to know that that's a thing. Because they're 20 and 21. They should not realize that they're lucky to have me. But they are. And I'm glad that they are. But it means that as things destabilize for everyone else, I will have answers for them. I'm not worried about my kids. I'm worried about the kids that don't have me. I'm worried about the kids that are going to be in the rural areas of Oklahoma, where that funding is going to be stripped from the schools further, where it's going to be stripped from IHS further, where it's going to be stripped from the universities further, and there is no hope of ever surviving. Because the reality is that while so many people dip into poverty throughout their lives, there are generations of us who have been in generational poverty for decades, for generations, for hundreds of years. And we know how to move forward. We know how to listen to the people that came before us, so that we understand what we can be doing. Instead of just saying, as the chant went last night, cancel the cuts. Canceling the cuts isn't enough. It will never be enough, because we have not been serving our most vulnerable populations that have been put in these situations for years, for decades and centuries. And my kids don't deserve that, and those kids do not deserve that, and I do not deserve that. No one deserves that. We should be able to do the baseline of just helping people get the access to the care that they need. I am on an ACA plan myself, which means I'm going to start paying these higher premiums, which means that my transition-related care may no longer be covered by my insurance anymore, because they rescinded that as a overall benefit that ACA must cover. I don't know what's going to happen to my trans health care, but I do know what happens to my mental health when I don't get it. And I know that I don't qualify for Medicaid in any shape, form, or fashion in Texas. And I never will. And we continue to allow ourselves to think that we can just do the status quo. We continue to think that the best way that we can move forward is to keep the status quo, where we're spending millions and millions of dollars on a select few people whose parents can advocate for them to get into the day hab facilities, to get into the sheltered workshops, to get into group homes. Which is really upsetting, because when my son was 17, he ended up being homeless. He was not allowed to live with his sister. He had gone to live with my mom. And we couldn't get him into a group home. We couldn't even get him into an institution at 17 and homeless and autistic and not being able to support himself. We solved the problem, but not through the state. We solved it through community, and we need to continue to come together as a community and build up these new systems that can do better than what these systems were doing before, because we don't have the ability to wait for them to come after us. That is not sustainable, because it's going to keep coming. They're going to keep coming. We are only 6 months in. On Saturday, it will be the ADA. On Saturday, I turn 43. And I know that we must be building for a better future together right now, because we don't have to wait to see what happens when everything's destabilized. It's already happening in states like Texas. Every single day, more and more kids lose their access to health care, to quality education services that is billable to Medicaid. And there is nothing more that we can, there is not a reality that is not going to continue to occur. And the destabilization and the removal of so many Medicaid dollars and the higher burden cost that comes with the new provisions is only going to make it worse, not better. But we cannot pretend like it is just losing Medicaid right now. It is about all of us and the amount of deterioration we have seen across the entire United States. Because while everyone here on the coast and on the other coast believes that these are things that we need to claw back, no, we need to build for the people that are here now, with us now, so we don't die from what they're doing. Because people will continue to die in red states, and some will die in blue states too now. And we do not need that. We deserve to live. We deserve to be able to contribute to our communities in the ways that we can, whether that's being productive or by being there for others. It's hard to imagine when I get up on stage, right? Because I do come from Texas. And I've lived in Texas the majority of my life. I grew up in Texas. I'm a 5th generation Texan. I'm really proud of that. Even if our state has a really hard time believing that I matter. And so when I hear people talk about the things that their kids get, that they're now afraid of losing, I can't imagine it. I can't imagine having access. I can't imagine having that quality of care for myself or my kids, because it hasn't ever existed for us, and it probably never will. And instead of listening to all of us that are in that position, you put us on pedestals and say, look at those people that are going to be hurt the worst, instead of listening to us about how to rebuild. And we have to rebuild. And we can do it while they're tearing it down. There's no reason we can't build beside the destruction. And I truly believe that. I do it every day as I work as a treasurer for Crushing Colonialism. I do it every day as the executive director of Foundations for Divergent Minds, an autistic organization that's doing systems change work. And we've been doing it for 7 years now. We've been building in Texas a global movement of people that believe in what we're saying, because we are in the lion's den. We are the people that are suffering the most and at the most risk, and so people listen to what I'm saying. And so I truly believe if everyone keeps on listening to what I'm saying and what others like me are saying, we can make it through this. And it's not blind faith or hope. It is knowing we have the answers, and that if we get everyone to work with us together, we can do it. But we must have everyone listen, and must have everyone believe us on what are the solutions. It is not the status quo that people are trying to get back to by saying cancel the cuts. It is moving forward with the knowledge of what it takes to build community access for all. To stop looking at it as a piecemeal for each individual person and instead look at it as a public health crisis. Because it's both. It's an individual health crisis and a public health crisis. And we can do this. I'm going to stop here. Thank you, everyone. I appreciate you.